Hello there, I'm super excited to come your way every week with the baby doctor. I'm Bernice Abubedulansa. Thank you so much for watching us every week. Today we are discussing feeding the newborn. Health experts recommend exclusive breastfeeding for the first 6 months of a baby's life. This is the ideal situation. But what do you do if you cannot achieve that? Join Dr. Coy and I as we discuss feeding the newborn today.
When you enter any of our COI facilities, you will be met by our pleasant front desk officers, where your child will be registered in our system, after which you will be led to the nurses station. Our competent nurses will triage your child, and the needed first aid care will be given when necessary. Your next point will be the consulting room. Our proficient and friendly doctors will examine your child and give the appropriate diagnosis and treatment. From the consulting room, you may require the services of our laboratory, which is managed by highly skilled laboratory scientists, and then to our well-equipped pharmacy. When it becomes necessary to admit your child, you will be nursed in either our general ward or private ward according to your preference. At COI, we aim at giving you the best, your child's well-being, our passion.
This is the Baby Doctor, the show that makes homes, because children must be happy, and we are all about that. We are all about making your home happy. And how do we do that? We give you vital information for the well-being of your baby and your child. And we know that once baby is happy, it has a ripple effect, right? Everyone in the house is happy. Dr. Coy has joined me once again. Hello, Doc. Good to have you.
Hello, Bernice.
Yes, and that was a good conversation we had the last time on jaundice. This time round, we are looking at feeding the newborn. It's quite an interesting area for many women. We're always excited when baby is coming. Sometimes we don't think about how to handle baby after baby arrives. All we want to see are the cute cheeks, the beautiful eyes that are, you know, all over the place, trying to figure out what's happening around them. But it's important what the child is having. We have come across stories of babies that are born and mom is not able to produce the milk as soon as possible, and there's a bit of a delay, and some people say, oh, give it time. But how much time is recommended? What should be the baseline in terms of feeding a child once the child is born?
Okay, thank you. I'm happy to be here once again. Breastfeeding, that's what we are talking about, I presume, from the question. Yes, as soon as baby is born, baby should be put to the breast. It doesn't mean your breast has to be engorged first, but then it is recommended that as soon as baby is born, within the first hour, baby should be put to the breast. And interestingly, when baby is born and he's put on mommy's chest, the baby will look for the breast and suckle. Yes. But I must say that is how soon they should be put to the breast. And parents, mommies don't need to worry about whether they are getting enough or not. We know that the first 2 days, there's not much milk coming out. But what comes out, that very deep colored thing, which sometimes you see like teardrops. Yes, we call it colostrum. It's so rich in nutrients that you don't need much to be full. So we know that mothers will produce less than 100 mils of that in a whole day, yes. But it's more than enough for the baby. And so the baby has about 24 to 48 hours just to feed on that, and will be fine till mommy's breast milk comes plenty. And if baby is put to the breast early, then it stimulates the production of milk. And so you don't have to worry about after third day the worst time is post-surgery. Don't know why we think after surgery, mommy should be left alone and baby should be left somewhere till mommy can walk.
They say it's to give the woman enough time to recover.
Baby can suckle. Suckling on a mother's breast, you don't have to sit up to breastfeed. So baby can come and lie on your chest. And even playing around the breast, licking it a bit will stimulate production. So, and if baby is sleeping, mommy needs not panic because they come out tired too.
Yes.
And so they will suckle for a few minutes and we sleep for longer. But that's okay.
That's why
Nothing
I was
will
asking
go
what the
wrong.
recommended time is, because then sometimes you see from the point of the healthcare giver and even those around mommy, and I'm talking about the older generation, there's such a pressure on the woman to breastfeed, and sometimes it frustrates the women. I've had people who've had children recently tell me that the milk is not coming, I'm frustrated, and they're saying that the baby will fall sick and this and that will happen to the baby because he's just sucking for about 5 to 10 minutes and baby is done.
That is fine. If baby attached well and sucks for 10 minutes and goes to sleep, baby is not hungry. If baby is hungry, he'll wake up and cry.
Okay.
Okay. The only group of babies we worry about are the very big babies, more than 4 kilos, and then the very tiny ones who we know will not be able to hold on, the premature babies. But a regular child who is able to suckle well for 15 minutes and go to sleep, leave the child alone. That is one of the myths that people have, and so we get worked up looking for plenty breast milk, and because everybody is putting pressure on the poor mother, she gets stressed, and so is not able to produce. So it's a vicious cycle, because stress will reduce production of breast milk. We should allow the mother to be happy that the baby has arrived, allow her to do what she can do best, let mommy and baby be. After they've rested for a while, mommy will have plenty milk and baby will suckle more. And so, yes, we end up putting so much pressure on the mothers, and that's one of the reasons why many mothers are not able to do it well in the first day or two. And then also sometimes I think we have very anxious health workers who are very quick to pour alternative milk in the baby's throat. But the baby can go for about 12 hours and it's fine with the little that you get. Yes. For the newborn, it's fine.
Beyond stress, which we will get into much later, what are the other reasons why a woman may be unable to produce enough milk to feed the baby in the first few days?
I try to stay away from the word enough, because who is determining enough here? Okay. The enough is being determined by mother and all the support team who have their own definition of enough. So far as mommy gets the little yellow coming out of her nipples and baby is suckling well, baby has enough.
How do you know baby doesn't have enough? When baby cries?
When baby is fussy and is crying and crying and crying. So normally by the third day, second day, third day, the breast is all engorged and is plenty. Yes, the colostrum is gone out. So the colostrum has been made by God to take care of the first 24 to 48 hours.
Okay.
When you are not going to get the bumper, you know, when you can produce like 500 mils from one breast, no. So it's about 85 mils, less than 100 mils, and it's enough. It's packed with all the nutrients that the child needs. So if the child is suckling and is going to sleep peacefully, we will say the child is getting enough. Okay, and so that is it. The plenty that every other person is calling enough normally comes after the second day. Okay. Yeah, so that's what we should know. Yes, a few mothers may not get any milk at all. They may be very stressed, they may be sick. That's a different, but they are not the majority.
Okay.
But I think now we are getting into the state where we are making the minority the majority. And that's why I didn't want to go along the enough line. Yes, but then there are few who genuinely realize that not even the yellow is coming out. So then in that case, genuinely she's not lactating. And in that case, yes, you may give alternatives to the child as support. But even in that instance, we prescribe, or I prescribe, that let the baby suckle, and then I'll top up. Because when the baby is hungry, he will be more active in suckling the breast. And the suckling of the breast is going to stimulate production of breast milk. If you don't suckle, there will be no milk. So the baby should play around the breast, and then if genuinely nothing is coming, we will top up so that the mommy is also not stressed. Yes. But that is not the norm. So now this new trend where every new expectant mother is going with a tin of milk is wrong. It's wrong. You set the stage already to ensure that you do mixed feeding. And the average mother, after paying so much for a formula tin, will not let it go to waste. Yes. And so now we have a new trend even when they have started breastfeeding, lactating in the hospital, they will tell you when they come to the clinic that in the hospital they gave the child. So when I went home, I continued. So I give it at night, because in the hospital they initiated that the child was not getting enough. And so at home I'm making sure the child is getting enough by at the end. So we have introduced it. There's no need for her to have gone, because out of 100 children, only maybe 2 may need formula. So why are we buying 100 tins of milk when only 2 out of that whole group may even need the formula? Yeah.
You've spoken about stress, which affects the production of milk greatly. But are there other things that we may be doing or not doing to aid that process of milk production?
Yes. For breastfeeding, for successful breastfeeding, there are 2 components. There's the maternal component, and then the baby factor. Right. The maternal component, rest is key, and eating well is key, and taking a lot of fluid. Please, I should put in a disclaimer here. I see eating well being defined as chewing all the corn and nuts that you can lay hands off. No, it's not necessary. All you need is a lot of fluids and eating a balanced diet. And I think, thinking through this whole chewing corn business, I think the benefit is when you chew corn, you get very thirsty. So you drink a lot of water. Okay. So
that's the best scientific explanation you can give to
the whole thing. And so, you know, they'll give you a bedroom, and then you chew corn and you are drinking water, and so it's fluids. Rest, balanced diet, fluids. And then the baby factor, letting the baby latch on well to the breast. And I think that's where over 50% of our problems are. The latching on. The definition of correct latch on varies from person to person. And sometimes, because we don't know better, we think that when the baby holds the nipple, that is fine. Let me say, many mothers think their baby's mouths are too small for them to hold their big breast. And so they just put as little as possible into the child's mouth. And so when you do that, the child doesn't get to where he sucks and gets plenty milk. So what happens is that he sucks and sucks and sucks. 30 minutes, 45 minutes, you are still breastfeeding. He finishes and he's still crying after 30 minutes. And tired. And so that is the wrong position, latching on. And that's one of the main reasons why many mothers are bottle feeding and are topping up, saying that the breast milk is not enough. It is because the breast milk stayed in the breast and the child was busy sucking the nipple.
So there is the activity of something that has a semblance of breastfeeding. So the baby is just sucking, but the milk is not...
It's not coming as it should.
Okay.
Yes. And since we've touched on that topic, it's like my pet area. Let me say that, yes, the breast, we all know that the nipple is the pointed part. And next to the pointed part is a dark part, which is the same color as the nipple.
Yes.
And then the part that looks like our skin. The baby's lips are supposed to cover the broad part behind the nipple. Yes.
Black
the
surface.
Entire black. Many mothers say, hey, the mouth is small. And my answer is...
We fear that the baby may choke on.
No. And the nipple should be actually past the cheek.
So it should go at that angle?
That far.
Okay, go past the cheek.
Yes, it should be in the... So the lips is for the areola. And the nipple is supposed to be out this far.
Okay.
This far. It's unfortunate we don't have pictures. So if you give the nipple and he holds onto the nipple, that's when it hurts. That's when it cracks. Okay. And every mother, I always say, now I tell my new mothers, have your own experiment. Squeeze. Close to where you put my baby's lips. and go back to where the dots are. You know, the big black has these dotted areas at the junction between the black and the skin. Squeeze that place. Check from the two places where you get the most squirt of, the best squirt of milk.
Okay.
Where you get the biggest squirt is where the lips should be.
Okay.
So if you go around the nipple and don't get much, you see you get teardrops. You go to the big dotted area and it splashes. So that is where his mouth should be. Worried about the size, if your child is crying, looking at the mouth, it is nowhere near the size of your areola.
I like that.
So when that mouth,
I like that.
that's the size of the mouth. So if the mouth can take that, can look that big, sometimes
yeah.
it's bigger than your whole breast when you're screaming.
that loud.
Thank
yes.
you. So use that as your assessment of the size of the mouth. Then you realize that your areola cannot let him choke.
But Doc, there are those who say that the different nipple types can affect the ability of the baby to even latch, and they say that, oh, she couldn't breastfeed because she had this type of a nipple.
Yes.
Is that a myth, or it actually is problematic sometimes?
It is problematic sometimes, but it is no excuse for not breastfeeding. Because I know we talk about the flat nipple and the inverted nipple. Those are the popular ones. So there's the regular one which protrudes, the flat and the inverted. Ideally, yes, you can pull on them to bring them out. But it is not the nipple that produces breast milk. Okay. It is the breast. Okay. The nipple is just the external conduit. So the areola is there. That's where you suck to get milk. And then the milk will squirt out from the nipple. And most of the time, if the child holds onto the areola, the nipples pop out. Oh. Yes, so we look at the nipple, oh, flat. But it's a bit difficult for the child to hold, especially when it's engorged and it's all flat or inverted. But inverted and flat nipples per se do not mean the child cannot breastfeed. And most of the time, after a few attempts of holding on to the breast, or sometimes you can even pull it out, let the child latch onto the areola, and then it will stay out through the feeding time. So it is the breast that makes milk, not the nipple. So whether nipple is hidden or is showing, there's milk in the breast.
Okay. So we've learned the best way to have the child latch onto the breast, and how far, you know, the tip of the nipple, or let me call it the nipple in this case,
yes,
should be. Doc says as far as this in the cheek, just beyond it. But Doc, the positions of feeding, what is the best way, one for the mother and for the child? And I'm saying this because you realize that many babies are unable to feed and they get fussy, not because they don't want to feed, but they may have colic issues, and so they are uncomfortable. How do the breastfeeding positions aid in creating that problem?
Okay, so I would address the colic issues. Half of the colic issues is poor latch-on technique.
Okay.
If you give your baby the nipple and you hear all the noise, he takes gas with the milk and he doesn't get much. So he gets more bloated and he has more colics. As soon as he takes a bigger areola and then goes down, you realize that he takes more milk, less gas, and colics reduce. Okay. So that's one of the challenge. 2, if he latches on well, he stays on the breast for less time. The stomach is that big, it's small. It's like a little pouch. And so if you breastfeed him for more than 30 minutes on one breast, there's something wrong. If he latches on normally by 20, 25 minutes, he's full. And you realize that the breast feels very empty. Yes, so that is it for the colics and all. The positioning, it varies from mother to mother. I know they have the football type where the child's legs are at the back and he's in your palm. And then we have the cradle type where he's on your tummy. Some will lie down and let the child lie by them. Yes. Whichever method the mother is comfortable with, it's fine. The key issue is for the baby to get the whole big black in the mouth. And what we should all avoid is when we all try to protect the baby's nose. And so they'll keep telling you, protect the nose. And in your bid to
because the baby will suffocate when especially if you have very full breasts and you're pressing against baby's nose.
Yeah. Ironically, by the time the baby comes out, he's smart enough not to suffocate. He doesn't need any mother's help. If babies are suckling and they are really suffocating, they will stop to breathe. I mean, for those who've had children who've had common COVID, nasal congestion, they will confirm. He keeps stopping to catch his breath because the nose is blocked. So normally, if you put the areola in the mouth, for example, let me use the cradle one, which I'm very familiar with, and you put the head in the angle. As soon as all the black goes into the mouth, the angle corrects itself, the nose is clear. What happens is when we put the breast on the face, and it's only the nipple that has gone in, then we end up pushing everything on the child's face. So if the child's head is up to the corner and he takes the breast, God has made it like that the angle corrects itself. So you don't need to put your fingers there to try and push back your breast, because when you try pushing back the breast, look, most of the time we are pushing back the black part, which is where he sucks to get milk. And so you compete with the child for the place where he gets milk. So it becomes a hassle. Then he starts crying, he's fussy, he's unhappy, and it's because he's not getting enough when he sucks. So every mother's hand should stay away from the black. If you want any part where your hand will hold, let it match your skin color.
Okay.
So it should be as far to your chest as possible. I always say that makes you feel like a mommy as a Ghanaian. So you should be holding something. So just hold the breast, but leave the black parts for the baby. Whatever position, so far the baby can hold on to the breast, that you are not having pain when you are breastfeeding, then you are good. When you are having pain, there's this myth that is normal. It's a myth.
Okay.
When
you must not feel pain.
No, it should be comfortable.
All.
Initially, first week or two, a little discomfort. But when there's crack, and it's so painful that you are snapping your fingers, then there's something wrong. Push a little more of the areola in the mouth. Also, if the child is not getting full, then, I mean, he's crying in between feeds. If he feeds well, he should sleep for at least 2 hours before he needs food again.
Okay.
So if he's not able to do that, that means he's not getting enough, and it's more often than not is the position. And then also appropriate position, yes. I think I've said basically yes. So she should be facing you and make sure that all the big black is in the mouth. The nose is automatically free when you put the big black in the mouth. And then you should make sure the child burps after feeding.
Okay.
And then I must add the burping part.
It's very stressful. Some of the kids easily burp with about 5 to 10 taps at the back. Some of them, it can be a lot of hard work for. Is there a right way to do it?
Yes, sometimes I jokingly say that the way we pamper the gas, if I was the gas, I won't come out.
Oh.
Yeah, we are all lovey around it. Just cup your hand.
Okay.
And pat at the middle
Like
back.
this?
Yes.
Okay.
So that the body vibrates.
The middle back.
Yes. The
Okay,
body
not
vibrates.
the upper part.
No.
Okay.
Because the stomach is close to the middle back.
Okay.
There's gas down there. You want it to come out. If I hit your neck and I'm asking gas to come out from your stomach, I think I'm encouraging the gas to stay down.
Okay.
That's my funny way of saying it. So the middle back, and then it dislodges the gas out.
Okay.
Yes. If after a while he's not burping, let him lie on his side. If he burps, it will come out.
Doc, so the burping part is problematic for a lot of women. Some of the children will burp with about 5 or 10 pats to the back. Is that the right way to do this?
Yeah, ideally you want a bit of vibration so that the gas will dislodge.
Okay.
The gas is in the stomach. And so I say hit across the back. Okay, and the child's back is not that big. Your palm can virtually fit. And so you just cup and pat. And
so
then
you cup this way?
Yes.
Like it looks like a...
Yes, I cup this way.
Okay, so
yes,
it's
so
like a hollow in between.
A hollow in between. So when I hit the back, you feel the child is vibrating, but he doesn't cry because there's no pain.
Yeah, it's not flat.
No, it's not flat, a pow, you know. And then it comes out. Some children will burp with or without any effort. And I always tell them, even if you try and he's not burping, just let him sleep on his side. He will burp eventually.
Okay.
Yes, so it's not a problem. For some children, when they are fussy on the breast, it's because they want to burp. They will stop. So as soon as you burp them, put them back to the breast. And I must say the best, you were asking about the right way of breastfeeding. Please don't do 5 minutes on one breast, 5 minutes on the other breast. The child should empty one breast before you move. And why? Because the first part of the breast milk is about 80% water. And the last part is the, the food. And I have a joke. I say, you know, the first part is like water and the last part is the banku and abenkwa. So if you drink only the regular morikuku, you get hungry early. The one who eats banku and soup and drinks water doesn't get hungry early. So if you do 5 minutes, 5 minutes, you fill the tummy with predominantly water. And so that child will also cry earlier because he gets hungry earlier. Just like if your friend eats banku and you eat kuku, the kuku person gets hungry faster than them. Yes, so that's also another important thing that mothers should know. You empty one breast before you move on. Somebody say, how do I know it's empty? Squeeze the big black place where you squeeze and you did get plenty. When it's empty, you squeeze that place, you realize that very little comes out. The big dotted part, not the nipple.
Yeah.
Yes, and after a few weeks of breastfeeding, you know, yes, your breast feels lighter. But prior to that, just squeeze that place. If nothing is coming out, birth the child and switch.
And in some of the babies, Doc, and I like that you mentioned that the babies are smart, because some of them will actually stop sucking when there's nothing coming in anymore.
There's nothing nice about job no pay.
So they will just stop sucking. That's an indication that there's nothing coming.
It's done. You give it to him and he pushes it out. Yes. Who works without any pay? Yes. So
And Doc, we'll go to the other forms of feeding besides breastfeeding, but because you've spoken about emptying one breast, how do mothers who prefer to express, how do they ensure that baby is actually having the full complement of one breast before taking the other one, so they don't get things mixed up in terms of what they have expressed and how to feed baby with what they've expressed?
Okay. I think now there's this new trend where mothers think expressing is it. Let me say something, that when you don't allow your baby to suckle, you don't get enough breast milk. Because you need the suck reflex to produce milk. As often as the baby suckles, he gets breast milk. In fact, that's why new mothers now are struggling when they come back from hospital, because they've been taught to use formula. And so the baby then is drinking from the bottle and is sucking less. So you produce less milk.
Okay.
And so ideally, my recommendation is this. Let the baby suckle. After 20 minutes, express. Find out what is left in the breast. If there's nothing, express the other one. And then you can top up the baby with a cup and spoon. I didn't say bottle teeth because the mechanism of sucking the breast nipple and the bottle teeth are different.
Okay.
And the baby under 2 months is still settling down. If you introduce the bottle teeth, which when you turn, even without any effort, is dripping, then as I told you about Job no pay, I mean, he's smart. If you can be assured of food, even if you don't work, or you can get money to spend if you don't work, none of us will bother to go to work. And so that child may go for the bottle teeth because that is less work. And mommy is also not even getting the nipple latching on right. And so he stops breastfeeding and he wants the bottle. And then you are gone, because give yourself 4 weeks, the breast will begin to produce less.
Okay.
So let the baby suckle, teach him to hold on to the bigger part, and then if after 20 minutes, let him baby, if he starts, top him up with a cup and teaspoon. If he's really still hungry, he will drink a little more.
Okay.
As he gets to know how to latch on well, you realize that the top-up volume begins to reduce. So at first I was doing 30 mils top-up. Then in about 3-4 days, it's only 20 mils, 10 mils. Less than 10 mils, stop topping up, because the baby is getting enough.
Okay.
And my top-up here is breast milk. So I express, and let me add, if you're a new mother, you are not getting enough breast milk and you are worried, when baby suckles on one breast and is full, empty the other breast and put the milk in the fridge.
Okay.
And drink water and rest. By the next feeding cycle, the 2 breasts will be full. That's why the 2 breasts will feed twins.
Okay.
So for one child, it's unusual not to get enough from the breast. So when you do that, The breast milk can stay in the fridge for 24 hours, nothing will happen. Can stay in the freezer for 3 months plus, nothing will happen. So do that, and then you will double your production. And as baby suckles well, there will be no need to express. Or for the working mothers, I tell them, express and toss into the freezer.
Okay.
Get a storage bag, date your breast milk.
Okay.
So you know which one went in first.
Okay.
And which one should. So by the time you're going to work at 3 months, 4 months plus, you have enough store. Because trust me, when you are leaving your baby for the first time, it's stressful. And you even begin to reduce production because it's a stressor.
And the suckling as
and
well.
And the suckling is not going to happen as it used to. And you are anxious. And so when you have a backup plan, then you are not a nervous wreck as you go to work. But then you express as you can because there's backup. If what you have is finished, mommy or nanny or whoever will just pick from the freezer and then and give to the baby. So that is my recommendation.
So the key here is to label and label properly. So you should know when you expressed, the order in which you express, so that when you are giving to baby, just like you will do with your normal breast, you would empty one before giving baby the other.
Yes, because when you use the breast pump, it brings out everything. And it gets mixed in the bottle.
Mixed up in the bottle.
So it's a one-stop shop.
Okay.
So you don't have to worry. Yeah, and the truth is, if baby suckled on one and went to the other and didn't finish the other, when you are going to feed the next time, start from the other. That's one of the rules. So that the more you empty the breast, the more milk will be produced. And he did half, so the top up will come. So, yeah, let's do it that way. And the more we empty our breast, the more. And now the new trend of keeping the breast milk, if you keep the breast milk in the breast, production reduces because God does not like waste. So the breast tells the brain that reduce production.
Because you're not taking enough.
The consumer doesn't need that much.
Ah, okay.
So that's what happens when you are mixed feeding. So when you are doing the mixture, you don't produce that much more. Because the suckling frequency has reduced, you don't empty as much. And so why should the breast produce more than necessary? There's no need.
Doc, let's look at the other options of feeding when breast milk is unavailable. So there are people, I'll say, people who live in the urban areas or people who are exposed to more modern ways will quickly opt for a formula. But we hear of stories of people in very deprived communities that will have no option. Say if a mother passes away, for example, we'll say, let's get some light porridge for the child. What are the feeding options when, like in the case you cited, there's absolutely no milk production or when mother is not available?
Okay. Interestingly, and when mother is not available and grandma is there, grandma can breastfeed. Yes. If you have had a baby before and a baby suckles your breast, you will lactate again. So in the past,
Doc, no. Allow us to process all of that.
Actually,
wow.
Yes. So if you listen, the olden days, you can say, then they gave the child to grandma and grandma. Yes, because she has delivered before.
The milk will come even if she's in menopause.
Let the child suckle. If you like, go and try it. You can go for your sister's child and let her suckle your breast and see you lactate because you had a child before.
Oh, wow.
Yes, so it's not all lost.
Okay.
It's not all lost. I know now because of infections and things, we are careful.
Yes.
But if the child's mom and if a sibling who's been tested and everything is fine, and they want to, they can. But if everything is, for example, maybe the mommy who was infected and everybody's not comfortable with what the child is bringing, then you could use formula. Yes, but formula is supposed to be the last resort. And I like the fact that you said in the urban areas they can afford, they go for it. Yes, you can afford to buy the container, but the package of allergies and other things you may not bargain for. And that's one of the cautions I give our new mothers.
Right.
Cost of the tin of milk is not a problem, but the other issues that follow. For children who may have allergies, when you give them the formula milk, you prime them up for a worse form of the allergies. Yes, research has proven. And I actually have a family that gave me the practical example. The first child, very bad asthmatic. The second one, I taught mommy to exclusively breastfeed. He has milder forms, so he just has allergic rhinitis. The mother got very exotic with the third child and decided to do formula again. Oh yeah, she has a worse form of the asthma than the elder brother. And so I always laugh at her that she should have a whole, she can be a training.
Yeah.
Yes, so that's the fact. The formula may be convenient now, but of course the risk of infections, the immune system that is not optimized, because the breast milk gives you maximum immunity. It enables the child to have better brain development. Yes, the child is well adjusted. All these benefits, you can't put money to it. And so we should not be quick to think that because we can buy the milk, we can do all these things. Yes, you can afford it. Breastfeeding options, yes. So you can afford the milk, but be sure that you can also afford the additional package. Yes, and it also goes, now people are also bottle feeding breast milk, and the risk of infection goes there too.
So we just need to put a little caveat here that this discussion is not on complementary feeding per se. After baby has gone past the 6-month period, we will have a much more detailed conversation on that, because that's another topic that needs to be dissected in different forms. So today we are talking about feeding the newborn, and that's why Doc is encouraging exclusive breastfeeding. You see, I'm trying to punch all the holes, but Doc is dodging all of it and giving me reason why you don't have an excuse to breastfeed. She says those who have an excuse are very, 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 very small in numbers. So
yes.
She's shown you how to do it. If you're not getting enough breast milk, maybe you find yourself in the category of people who are not allowing baby to suckle on the breast enough, or maybe you're not resting enough or taking in a lot of fluids and hydrating enough. So Doc, when it comes to sterilization, keeping the bottles and other things that we need safe, and the caveat here is that we are not talking about complementary breastfeeding. I just need to chip that in. We are discussing feeding the newborn, and so Doc is very insistent on exclusive breastfeeding, and we get it. So Doc, how do we keep, whether we're using a cup or a spoon or for a top up, or we're using bottles, how do we keep those things sterile and safe for baby?
Okay. Yeah, to keep your bottles sterile and safe, there are so many methods. I'm sure many of our mothers are Google doctors, so they go online and they go read so many things. For our environment, I prescribe, if you have a sterilizer, fine, but then one thing we should know is that when you finish sterilizing all your bottles and a contaminated hand goes in, everything in there gets contaminated. So it doesn't matter if I pick only one bottle, all the others will be contaminated. So you should as well let it run all the time. I like simpler methods, like not to prescribe one particular thing, but you know, we have this melting tablets and all these other forms of sterilization. You put a tablet in water and the water stays sterile for 24 hours. So that's one option. A simple method, let me put it in a chronological order. So if a mother gets maybe express breast milk in a bottle and baby feeds on the breast, on the bottle, and he doesn't finish the breast, hey, I'm sorry. And he doesn't
You
finish.
see, I told
I'm
you,
so
Doc is biased.
and he doesn't empty the bottle. Because of our peculiar warm and humid environment, my rule number one is take the bottle teeth off.
Okay.
Don't cap the bottle teeth and wait for the next time the child is feeding and put the bottle teeth back in the mouth. When you do that, by then a lot of bacteria have multiplied in the teeth because it's warm. The environment is warm. And so you wash it down the baby's mouth and gut, and then infections. And so first thing, take the teeth off. Then you can put the rest of the milk covered in the fridge. When he's ready, you warm it in hot water. Don't microwave breast milk. And then you can feed the child again with the new teeth.
Okay, and this is leftover milk from the same bottle.
Yes.
How long can I keep that in the fridge for?
Oh, till the next feeding time.
Okay.
Because the next feeding, that will be the first one that will go.
Okay.
Before you do the next.
It doesn't go bad?
Breast milk can stay for 8 hours on the desk.
But this has been used. I'm asking this because there are some people who fear that maybe the exchange of saliva going into...
Oh, I think it's far-fetched. That's the child's own saliva.
Okay. Right. Right.
So, and more often than not, it's not that much. If it's formula, I'll say discard.
Okay.
But for breast milk, it's gold. And so I'm careful how quickly I tell people to throw away their gold or nuggets, you know. So you can take off the teeth. The key thing is that don't keep it on the desk and let it stay for 2 hours waiting for the next feeding time. Take off the teeth, cover it, and then put it in the fridge, or even let it stand. Then the next feeding time you can that's maximum 2-3 hours. You are done with it. To keep your teeth and bottles, I recommend that have 2 buckets. I have a bucket with my sterile solution, and then I have a bucket for dirty bottles.
Okay.
And so when my baby feeds and finishes, I rinse it and toss it into the dirty bottles bucket. So like empty this bottle, the clean bottles, finish the clean bottles, and bring them all into the dirties. I keep doing that till all the clean bottles are finished. Then I wash all of them and let them go through the sterilization process. Okay. I could have maybe boiled as my sterilizing method. I could have used my sterilizing tablet as my sterilization method, or I could have been exotic to have the
device.
The device, yes. So whichever way I'm going to sterilize, I do not want to rinse, wash, and put the dirty one back into the pool, because there is that inherent risk of sending a contaminated bottle into the group of clean ones.
Okay. So
because
finish one cycle before
finish one cycle before you restart. And because when you are going to wash all of them, you take your time, you use your brush, you wash well. But if you are doing one, there's that tendency of doing a fast job and then you toss it back. But it has not been sterilized. It has not been boiled. The sterilizer has been off. So no sterilization will take place when it joins the pool. Good. And then we should always remember that whenever you are going to the sterile area, you should have washed your hands. Because if you don't wash your hands and you go in with a dirty hand, you contaminate everything in there. So that's how best to keep your bottles and the teeth safe.
Right. Something to digest. Let's just take a quick breather, process all that you've heard. We'll be back with more here on The Baby Doctor.
When you enter any of our COI facilities, you will be met by our pleasant front desk officers, where your child will be registered in our system, after which you will be led to the nurses' station. Our competent nurses will triage your child, and the needed first aid care will be given when necessary. Your next point will be the consulting room. Our proficient and friendly doctors will examine your child and give the appropriate diagnosis and treatment. From the consulting room, you may require the services of our laboratory, which is managed by highly skilled laboratory scientists, and then to our well-equipped pharmacy. When it becomes necessary to admit your child, you will be nursed in either our general ward or private ward according to your preference. At COI, we aim at giving you the best, your child's well-being, our passion.
Thank you so much for staying on The Baby Doctor with me, Bernice Abubeidulansa. Today, I'm here with Dr. Coy, and we are talking about feeding the newborn. We have established so many things. Doc has busted so many myths and helped us with some important education on how to breastfeed the newborn. She's also proven to you why exclusive breastfeeding is the ideal thing. Doc, there are those who say that we are putting too much pressure on modern women. Some say that this whole issue of it helps the child, brain, whatever, they say the first one, I did exclusive breastfeeding. The second one, I didn't do exclusive, but this one does better in school. I mean, so they're trying various ways to suggest that it's all the same thing, isn't it?
The same thing, no. My question for the one who is saying that this one even does better, do you know his potential? But for the fact that you did not breastfeed him, maybe he would have been super.
Okay.
So maybe you had a genius, but you've made him a standard boy now. Okay, so it's neither here nor there, just that we know the benefits in the breast milk. So if you can give your child the best chance, I mean, after all, that's why we pay for the best of schools for early years. We want them to have the best start. So why is it that when it comes to feeding, we don't want to give them the best start?
They say it's a myth, Doc. They say that, look, someone even suggested that we're putting so much pressure on women, and some of them, even when they don't have enough breast milk, there's so much stress, there's so much frustration, they end up not looking for other alternatives. And someone has actually put on Facebook that that's the reason why her child developed jaundice. I don't know what you think of it. She said if she had known that because she wasn't producing enough, the baby would suffer, she would have just gone for formula. But for the insistence on exclusive breastfeeding.
No, I agree. There are genuine cases of women who just cannot make enough. And I think it would be unfair for me to sit here and preach that every mother on earth will get enough. It's just that I know that many mothers who could have also had more than enough quickly hide behind that, but there are others who I have had a few who genuinely, no matter what you do, they don't lactate enough. So for those women, yes, you can't starve a child. It's between starving the baby and giving him the second best. So if the best is not there, you give the second best. If you can't get the best school, it doesn't mean don't go to school. You get some, you go to the next grade. So that is it. So cow milk is the next grade. And let me say, all formula are cow milk, except the one we say is soy-based.
The plant-based ones.
The plant-based ones. But then, so it doesn't matter the name we give it. If they say it's formula milk and they've not said it's plant-based, then it's cow.
Okay.
And so that is it. If you can't get your mother's breast and you can get the cow so that you can thrive, yes, then we give. But it's just that we encourage, I always think that it's best to let a doctor who is helpful. Let me put in this. Some doctors also don't, or health workers are not comfortable with breastfeeding. So they are not able to teach the mother to be empowered and
Doc,
get it right.
In other places, we have lactating specialists. In my reading, I came across that, and I was surprised. I was like, oh, people are so advanced, because once a mother has a baby, they say that if you're struggling with anything breastfeeding, contact your lactation specialist. But we don't have that here. So who do we go to, our pediatrician or our normal medical doctor or a midwife? Who do we speak to when we have lactation issues?
In Ghana, the midwives are trained to teach latch-on. The pediatricians are trained. I was trained. And so I know what to do. And then we have a few who are who have been further trained in lactation techniques and other issues. So yes. So I would say your first point of call should be your midwife or your pediatrician.
Okay.
And if the person is not look, the litmus test is if whoever you are seeing will not stop whatever she's doing and let you demonstrate what you are doing for the person to see where the gaps are. And it's theory. Put all the mouth in the baby in the bed. I always say go and look for another person, because teaching breastfeeding is an art. And that one I will say bluntly, it's apprenticeship. If I teach you how to make your hair, I mean, if I'm teaching somebody how to braid hair, and I sit there and tell her, twist, 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 she will never be good at the job. But if she's doing it and I supervise and I correct her when she gets it wrong, she gets it right and it stays with her. So if that mother is taught to latch on and she can tell the difference when she puts that baby to the breast the right way, she's empowered to do it. She's happy to do it because it's not painful. She's not bending over her baby. So I always struggle with any health practitioner who will give theoretical knowledge on breastfeeding and not let the poor mother show her what she's doing so that you can see where the gaps are. If the person is not comfortable doing, there should be somebody in their space they can call their lactation specialist. The lactation specialist is somebody who has been trained to help a mother put the baby to the breast and help the mother address any other challenges they may have. And let me put it in here. When you go abroad, cow milk is given free of charge. When you want to breastfeed, you pay to be taught to breastfeed because there's something better in it. So let's not kid ourselves that, oh yeah, everywhere they are giving. Yes, because they want, and now some countries are changing. Yes, a place we all like to refer to. Yes. Even some states have now are changing. But in the past, it was cheap because you go to work early. So you dose the baby cow milk and come to work. They've seen that the products are not great. And so whenever you are being asked to pay extra for something, you must know that there's something
good in there.
Good in that. So I think we should not be quick to say abroad they are giving formula, so it's not the gold standard. They've seen better, and they are changing.
Doc, let's look at the effects of poor feeding beyond malnutrition, which is the obvious one. What are the kind of things a baby will suffer when they are not getting the right nutrition from the breast milk?
From the breast
and is
milk.
there anything such as quality breast milk? Yeah. or because we've just established that some will produce more based on what they're doing, the rest they are getting. But is there a way of determining if this mother's milk is of more quality than that one? What influences that if there's anything like that?
Ironically, God has made the breast milk tailor-made for every child. So trust me, the mother of a premature baby's breast milk is different from the mother of a term baby.
Oh.
Yeah. There's more calories in the premature because he needs a little more to grow. So it's interesting. And when it comes to baby feed, the body will draw whatever is in the mother to make sure the baby is fine. So you must be depleted of all nutrients for the baby to get nothing.
Okay.
Okay. If your iron stores are low, they will draw whatever is left and make sure the baby is fine.
So baby will take whatever it needs.
Yes. And then the rest is yours to manage. So there are only exceptions where mommy is very sick. Then you may say she can't produce milk or all that. And I mean, some may be so sick they have to be on some medications for which we have to stop breastfeeding. Those are exceptions. And that one, please, we give formula.
Okay.
And for me, I don't prescribe one particular brand of formula.
Okay.
I said they are all cow milk. See what you can afford and give well, than to go for the top of the range and then you cannot buy enough and then you are now diluting double. Then your child will not get adequate. Yes.
Right. So, Doc, back to the question on the effects beyond malnutrition.
Well, immune system is also compromised. And then, of course, poor weight gain and poor development. And so that's what we know. And to answer the question about some of the signs that the child is not getting enough, the best judge is the weight of the child.
And that's why it's good to go
for your monthly weighing. So if a mother says, I'm not getting enough, she comes to the hospital, the child is not gaining weight. Child is fussy. You express, there's no milk coming. She's not lying.
Formula.
The truth is in front of you. This is a mother whose breast is almost empty. Child is not gaining weight. But let me put in, now modern mothers, one of our challenges is lack of rest. And it's not because sometimes we don't have any help, but it's because we will not let go of our phones. And so we use all the time that the baby is asleep to catch up with our friends. And the question is, yeah, boy or girl? It's not change, it won't change. So when baby sleep. When he's awake, he or she is awake, you can then catch up on your house chores. You don't need to wash in the morning for it to dry. Even you wash at night, it can still dry. So there's no rule that if you wash before 11, if you don't wash before 11 a.m., it doesn't. Yeah. So those are a few things that for the modern mother, we have to be aware of. Sleep is important. When aunties and grandmas come and we are still up during the day,
Just
tidying up,
catching up.
just in catching up, chatting, then we don't rest. Mind you, you did a night shift alone. All your friends were
That
asleep. Yes. And now we say that this should help. I agree. But they don't have breasts, which is producing milk. So let them do the help before the midnight shift. When they come from work, they should get useful taking care of the child whilst mommy rests. And grandmas too, if you let them stay up late, their blood pressure will go up. So let them also do the 8 to 11 shift, and then the night shift, mommy can manage it because she's had some before night shift rest. And then in the morning, you catch up on your sleep and let everybody else do the rest of the work.
Really important tips here for you, but we have more to share. Look at this. We'll be back to wrap up the show.
Breastfeeding. Breast milk is the best food for every newborn. Formula feeds are still below breast milk in quality. Babies do not get full on their mom's breast when only the nipple is given to the child. If your baby sucks for more than 25 minutes and is still not full, check where the baby is sucking. Painful nipples mean your baby is sucking wrongly, so get help. If your baby does not suck your breast, you will produce less breast milk.
Hello, do you have any questions for your baby doctor? Send a video or text to 0557 456 211. Would love to hear from you.
And those were your tips for today. Dr. Koy is still with me. Doc, we are wrapping up. Quickly, we'll do a mop-up of all we've discussed earlier. But before that, there are mothers who complain about children who are just lazy at eating. You say, whatever you do, this child will not. He's just so lazy. How do you deal with children who appear to have some form of bad eating habits?
Okay. One, yes, I mean, there are generally some children who do not want to stay on the breast forever. They will do 10, 15 minutes and they are done. And they sleep enough for 2 to 3 hours before they feed again. And they are gaining weight. For that child, he latches on well. He empties what he wants to take and is growing well, so don't worry.
Okay.
It is his style of feeding. He doesn't like staying on the breast for 30 minutes. That's okay. So far as he's growing well, don't worry, because baby is getting enough. If he's not getting enough and he's not staying on the breast, is it because he's distracted? Okay. You are in a very active environment, and so for that reason, the child is looking around, looking at what is happening. So he sucks a bit and gets distracted. Sometimes this other sibling is entertaining him or her, and so he's just busy watching them. In that case, you feed him in a quiet place so that he can concentrate. But for me, the test is the child gaining weight. Yes, and you see.
And sometimes they say, look in the child's mouth. What exactly are we looking for there if the baby is struggling to feed?
Oh, that one, if the baby is struggling to feed, we are looking at two things. Sometimes we talk about cleft palate. There's a hole in the roof of the mouth, and so he keeps choking on it or something. And then in extreme cases, they talk about tongue tie. But I don't want to make a big deal of tongue because half of the tongues we say are tied and have no problem.
Okay.
Okay. Yes. Tongue tie is only important when the child cannot suckle. Okay. And cannot coordinate the milk to go back. So if the child is able to suckle, is able to cry and make all the appropriate noise, please leave the tongue alone. Okay, so those are the things we look for in the mouth. Yes, I can count my whole career so far, I can count the real cases of tongue tie that we had to do anything about. They are no more than 2.
Wow.
Yeah. Half of them are not necessary.
Okay, and the tongue tie, for those of you who may not know, it's what people used to describe the tongue stuck to the base of the jaw or
of the mouth.
Yeah.
The floor of the mouth.
Yeah.
Yes, and there's no rule that everybody should be able to raise their tongue.
Okay.
We think, no, so far as you can speak, if we sample all of us here, some of us will not be able to roll the tongue up. Yes, and my teacher once told, he said, leave the 1 year, the child by 1 year, the tongue would have moved forward, and what you are seeing now, you wouldn't see.
Okay.
Yeah, so we don't fast. Sometimes in your bid to release the tongue tie, you may cut off the most important nerve that controls the tongue. then speech is gone forever.
Wow.
So sometimes you ask yourself, which is free, but our grandmothers love the tongue tie. So don't go anywhere. If the baby can suck and can cry, leave the child alone.
Okay. All right, Doc. So let's mop up. We've had quite a discussion. We've transitioned from exclusive. We've looked at formula feeding, keeping the bottle sterile, mommy getting enough breast, and the other things that could prevent her from producing enough, preventing baby from staying latched on and actually sucking from the breast, because it's much easier for us to pump and let someone else feed baby, you know. Okay, let me pump and feed, because pumping is faster, you know.
It's
do it
convenient.
fast, and someone else will feed the baby. What is the final thing you'd like to share with us, even as we wrap up the conversation?
My final message is that breastfeeding cannot be replaced with any other form. The bonding that goes with breastfeeding, the cuddling, yes, it looks like it's time wasting, but that's the time that you have no choice but to be with your baby. And it's worth that investment. When the child grows up, he's well adjusted, and mommy is his or her best friend, because you were there when it mattered most. And the benefit we get from breast milk, all the other formulas are working hard to get close to it. It's free. And yes, you may have money, but you could use the money in other areas that the child will benefit from, which will not be replacing the breast milk with formula, because the challenges that comes with the formula feed may not be that great in the long term. So I encourage mothers that let's breastfeed. I know we work, and it's always a challenge when we are going back to work, but let's use the first 3 months whilst we are home to store milk, so that when we are going to work, we don't get stressed. Thank you.
Thank you so much, Doc. And don't forget to rest your back, like Doc is doing, because
Yes.
sometimes we get tired. You see,
Yes.
it's not deliberate. Some of the women are just worn out, so it's easier for them to just do the formula.
Well, it's a choice. Get ready to be in the hospital more often when they grow up with your allergies.
That's a serious one. And on another day, we'll be discussing allergies in full. But that'll be it for today's edition of The Baby Doctor. I'm Bernice Abubedulans, and I've been interacting with Dr. Koy. Let me just say a very big thank you to Azel Vogue for my beautiful dress. I love the colors. I love the baby pink. I tell you, Azel Vogue is your go-to fashion place for everything you need in terms of fashion. You can contact them on 0244 155 266, 0244 155 266. Let me also say a very big thank you to Think Media, where we are bringing you this exciting program from. Think Media is your creative agency. Everything creative. Think Media. I'm Bernice Abubedulanza, and I will be back again next week with another exciting edition of The Baby Doctor. Take care.